This story now. The South African Society of Psychiatrists says there's a shortage of child and adolescent specialists, and most are in private practice. State-funded child specialists are only available in Gauteng, KZN and the Western Cape out of 9 provinces. For more on this, we're joined by psychiatrist Alicia Porter, who will give us more information. Alicia, this week being Child Protection Week, these statistics are shocking. Only 10% of our children are able to get access to mental health.
These statistics are really shocking, but I don't just think that it is a South African problem. I think it's a global problem. But, you know, with the increase in child and adolescent mental health concerns, where, you know, some stats are up to 1 in 7 children, 1 in 5 children in some studies show that they have a mental health problem. So these are alarming stats that have been made worse by COVID-19, and with the limits, you know, the limited resources that we have, not just human resources, but physical resources. You know, oftentimes I work in a child and adolescent clinic, and it feels like taking a knife to a gunfight every day.
Now, you know, the World Health Organization, I remember, especially during that embarrassing time of, you know, what unfolded in front of our eyes with Life Esidimeni, the World Health Organization actually rated South Africa one of the worst in terms of our lack of budgeting for mental health, especially in the public sector, which is, you know, what most people need, because it's not everybody who can access private health.
And that is indeed so. So only about 5% of the budget is allocated to mental health. But the issue is that with mental health, it's, you know, the budget is then concentrated in hospital care, for example. And hospitals are really geared to treat more the severe mental health conditions like schizophrenia and bipolar. So our health system really is geared just for crisis intervention. And children and adolescents are such a complicated or complex group of patients that they do require a lot more in the way of multidisciplinary team input, and don't necessarily, you know, all need inpatient care. So there's a discrepancy in the way our budget is spent, you know, and in terms of what it is that is needed, you know, in terms of the common mental health care problems like anxiety and depression. It's very difficult to access care, particularly in the public sector, because that's more outpatient based. And so we have more reactive healthcare system rather than one that is geared towards early interventions or even primary prevention.
Just lastly, Alicia, you know, when it comes to us not taking seriously, especially children's mental health, what kind of people, what kind of adults are we going to have in our country?
I think we are going to see the long-term effect because, you know, currently the average age of onset, even of adult mental health problems, they say the average age of onset is about 14 years. So you've got a lot of adult mental health problems that actually start in adolescence. And if we don't pay attention or even just heed the urgency in terms of child and adolescent mental health, what we're going to find is we're going to get a population where we're going to get adults who have, you know, mental health problems, but also it will impact on our economy because it will impact, you know, livelihoods. It also just increases the chances of pathology in adulthood. It increases substance usage problems. So I don't even think we can truly appreciate the long-term consequences or sequelae of untreated child and adolescent mental health problems.
Thank you so much for speaking to us, Alicia, about this very important issue. I have to leave it there for now because I must